Now that we've discussed the movements of the thoracic cavity, we're going to discuss the muscles of the thorax, or rather, more so the muscles of the thoracic cage. So our learning objective in this video is to describe the arrangement, action, and nerve supply of the intercostal, subcostal, and transversus thoracic muscles. We'll talk about the blood supply in the next video. So let's get started talking about those muscles. And don't you love this little dinosaur? All right, so we're looking at a cross section here. So this is as if I split you transversely in half and around the level of the lower ribs. You would be able to see these muscles. And we've got 3 layers of intercostal muscles. We've got and we can see them well here, the external intercostal muscle, the internal intercostal muscle, and then the innermost intercostal muscle. So let's talk about each of these. We have 11 pairs of all 3 of these, and let's start with the external intercostal muscle. The external intercostal muscle will fill the intercostal spaces from, if you look posteriorly, the costal tubercles, and then it will go anteriorly to about the junction of the ribs and the costal cartilage. My arrow got in the wrong place. Where you'll see the muscle will end and you'll have this fibrous membrane. And this is known as the external intercostal membrane. So the external intercostal muscle does not go all the way to the sternum. It's going to be deficient here in front. If you viewed this muscle from the side, the fibers would travel anteriorly and inferiorly. So you see the external intercostal muscle here, and those fibers are traveling anteriorly and inferiorly. And here you can see that external intercostal membrane, because the external intercostal muscle does not go all the way to the sternum. It stops right about where the ribs and the costal cartilage just join. Now the internal intercostal muscles, we see, we went too far back. In the middle here, this is the internal intercostal muscles, and this will be the middle layer. And this will fill the intercostal spaces. Remember, there's 11 of them from the lateral border of the sternum anteriorly. So you see it's all the way anterior. The external intercostal does not go all the way. But as it's traveling posteriorly, it will end at about the costal angle posteriorly. And from the costal angle to the costal tubercles, they'll be replaced by a fibrous membrane, just like what we saw up front with the external intercostal. The internal intercostal will have that fibrous membrane posteriorly, and this is called the internal intercostal membrane. Now, if you looked at this muscle, the internal intercostal from the side, the fibers would run the opposite direction or perpendicular, and they run posteriorly and inferiorly when you view them from the side. So the differences there is that the external intercostal muscle has the fibrous membrane up front. The internal intercostal muscle has the fibrous membrane in the back, and then their fibers run perpendicular to each other. Now, the innermost intercostals will fill the middle of the intercostal spaces, and they aren't going to go all the way to the costal tubercle or all the way to the sternum. They have the same orientation as the internal intercostal muscles, so posteriorly and inferiorly. If you see, they don't have the innermost intercostals showing, but the fibers are running anteriorly and inferiorly, just like the internal intercostal. They are going to be separated from the internal intercostal muscle by this neurovascular muscle. So you see it here in this picture, the green that's traveling between the innermost intercostal muscle and the internal intercostal muscle. And this is going to contain the posterior intercostal artery and the posterior intercostal vein and the intercostal nerve. And they'll be arranged from superior to inferior in the vein, the artery, and nerve. And we can see that in this picture. So you have it doesn't say posterior here, but the posterior intercostal vein, the posterior intercostal artery, and the posterior intercostal nerve. And this isn't 3D, but this is, you can tell they're stacked on top of each other. The vein is most superior, the nerve is most inferior, and they're going to travel in the that groove that we saw on the ribs that holds these structures. Now, deep to the innermost intercostal muscles, which you can see kind of in this darker brown here, you see the external oblique, or not external oblique, that's in the abs, right? The external intercostal muscle, the internal intercostal muscle, and the innermost intercostal muscle. You see the nerves and the artery and veins separating or going in between those two. Behind or deep to the innermost intercostal muscle, you'll see the endothoracic fascia. So this is going to be a loose layer of connective tissue, and it is also the parietal pleura, or parietal layer of the pleura. So pleura is a serous membrane, meaning that it excretes this watery type fluid, and this is the deepest layer of the thoracic wall, this parietal pleura here, and this is known as the endothoracic fascia. If we go any deeper, then we're looking at the visceral pleura, and this is actually lining the walls of the lungs, or the outside of the lungs, exterior surface of the lung, is that visceral pleura, but that is not part of the thoracic wall. The endothoracic or parietal pleura is the deepest layer. Now, all of these intercostal muscles are supplied by the intercostal nerve of the corresponding intercostal space. So if this was, say, a T5 rib, or the fifth rib, then it would be supplied by the fifth intercostal nerve. You might be wondering why we're not talking about serratus anterior. We'll talk about serratus anterior more in gross anatomy 2 when we're talking about the muscles of the pectoral girdle. Now, the main action of these muscles, if we look at the external intercostals, they're going to be more active in elevation of the ribs. The internal intercostals and maybe even the innermost intercostals are more active in expiration or depression of the ribs. But their primary role when they act together is to stiffen the chest wall, which will prevent the chest wall from sucking in or blowing out the thoracic wall with the changes in the inner thoracic pressure. So it helps to keep the shape of that thoracic cage by keeping the wall intact. Now, there's a couple other muscles I want to talk about. The first muscle is the subcostal muscles, which you're going to see more in the lower part of the posterior thoracic wall. So you'll see this in lab once you take the heart and the lungs out of the chest cavity and you clean up the back. You can see these subcostal muscles in the more lower part of the posterior thoracic wall. They're going to descend from the internal surface of one rib to the internal surface of the second or third rib below. So it's different than the intercostal muscles. Remember, those only went from one rib to one rib. They only spanned one intercostal space. This will span 2 or 3 ribs. And the fibers of the subcostal muscles will be parallel, and you see here, you can tell, with the fibers of the internal and the innermost intercostals. So that could be a test question, right? I could ask, which muscle does not have fibers that run posterior and inferior? And your choices may be external intercostals, internal intercostals, external intercostals, or subcostal muscles. And your answer would be the external intercostals, right? Because those go anterior and inferior, while the rest go posterior and inferior. The other muscle that I want to talk about that you will see in lab when you take the anterior thoracic wall off, if you look on the inside surface of that anterior thoracic wall, you will see these transversus thoracis muscles. And they're going to originate from the posterior surface of the xiphoid process and lower part of the sternum, and then insert into the second through the sixth costal cartilages. So you see them there. The subcostal and transversus thoracis are supplied by the intercostal nerves, just like the intercostal muscles are, and they likely depress the ribs and costal cartilages, respectively. Serratus posterior, superior, and inferior, and levator teres castorum are also considered to be thoracic muscles, but we saw them when we were talking about the back, so that was in the last phase of the class. If you want to review those, I would suggest checking out the videos from, I believe that was week 2. So now you should be able to describe the arrangement, action, and nerve supply of the intercostal, the subcostal, and the transversus thoracis muscles.